Okay, so today I'm going to talk a little bit about health literacy and teaching adult learners what they want to learn, because health is such a broad topic and everybody needs health, but it can be really scary to dive in. So the first thing, my name is Andrea VanDyke. I started working with the Literacy Council back in 2017 as a student intern at WMU. I then transitioned to be the health literacy navigator and the health literacy lead instructor. And I did that for about a full year. I was able to do in-person classes from 2017 to 2018. And then, as we all know, the pandemic hit. And so some things got a little dicey, and I do virtual classes now. I also coordinated and instructed the WMed active citizenship volunteers. So that was helping the prospective doctors learn how to communicate with different people who might have education in medical field, who might not have education in the medical field, people of lower learning, people of higher learning, and everybody in between, especially because when health takes over, sometimes everybody panics, and even the most educated of us don't know what's happening. During that time, I also did the SNAP education, which is the Supplemental Nutrition Assistance Program, in collaboration with the Van Buren ISD. So I taught health classes to ESL and then other KLC learners. I've helped with 2 different summer health literacy programs and the ESL program of 2018. And this year I did the virtual Read and Seed summer program of 2021, which was a lot of fun for me. I really like that book, which is the Seed Folks. And Lauren, who is no longer with us in the KLC, she did the in-person part, and that was very exciting to collaborate with her. And now I teach health literacy on Friday mornings at 10 o'clock virtually. So, as we have all learned, one of the best ways to connect with anyone is to greet everyone with a smile. So, I always try to say hello, and I say everybody's name as they come into class, especially if they're a new student or somebody that I might not have seen in a while. Oh my gosh, it's so great to see you, Jen. I'm so glad you're back. Michael, thank you for coming back again. It's really great. Just make everybody feel warm and welcome. Share small things about yourself. So I have a dog. We talk a lot about my dog, but this is something that people can connect with. You know, they know that I am a human too. I also have problems. You know, there have been times where my dog is barking and guys, I got to go for 2 seconds. If I don't go let him out, it's only going to get worse. Everybody has life. It's just a way to show that life keeps going even while we're learning. And then I ask them what they want to know. My first few lessons, we specifically spend talking about who I am, who they are, what do they want to get out of this class. Originally, I thought we might be doing a book, what to do when your child gets sick. Well, the 3 people I talked to, nobody had kids. Why would I teach a book where nobody has kids? So we transitioned. We did some completely other things, but it's not at all what I thought I was going to do starting this class. And then at the end, I usually have a couple of lessons in mind for what we might do. But sometimes somebody says, you know, I talked to my aunt this week and she talked about diabetes. Can we talk about diabetes sometime soon? Perfect. We'll talk about that next week. Always, I thank them for coming, and I truly look forward to seeing them the next week. One way I also do that is when I see them the next week, how was your week? Did anybody do anything fun? Guess what my dog did this week? He rolled in the snow. Can you believe it? just something to really try to connect with them. So again, in the first few classes, I ask about them. What are things that they want to know? If there are things that they already know about health, things that they're not really interested in learning, I found out they're not super interested right now in learning about prescription labels. They've done that a lot. They're not interested. We're not going to talk about it for a while. Maybe in a year we'll come back to it, but not something they really want to talk about. Again, what do they want to learn about? Is there something that they're really wanting to know? Perfect. That's exactly what we're going to do. And is there anything that they want to share about themselves? They might not say it's about them. They might say, my aunt has diabetes, or someone I know has this, but that's okay because it's still an interest to them. And again, do they have any special interests? Did they go hiking one time and they were bit by a tick and they got Lyme disease? But they don't really know what Lyme disease is, but they heard they have it, and now they have to do physical therapy because it messed up their nerves. But what is Lyme disease? Why is that important for them? That happened with 2 students separately. We didn't know it until I went through the Lyme disease lesson. But, what are some things that they want to know? Everybody's going to listen if you talk about what they want to know. So my lessons typically go like this. We have our hello. We do vocabulary, typically a vocabulary game, which ends up being a lot of matching because it's hard to do a lot of vocabulary games virtually, I've learned. I would like to spend some time this next few weeks and figuring out some more. I think we're getting very tired of my vocabulary matching. And then my next slide or two is usually what is the lesson topic. So what is bacteria? What is a virus? What is diabetes? And then we'll go into the more specifics. And I always end things on, do you guys have questions? Do you want to go through it again next week? Come back to me with questions next week. I understand. Sometimes you have to think about it for a while before you think of a question. So we're going to go through a small lesson. So in your packets, if you're following along, you will see that they are slightly different from mine. But the lesson we're going to talk about today is health literacy and bacteria. So this is a lesson that I did with students, not that long ago. And so the first thing, like I said, is we start with bacteria. The lesson is bacteria. The first thing we start with is vocabulary. So I just want you guys to think about it. What do you think a definition for medication is? And then, so it's a treatment using pills or other medicine. And then we talk maybe about some of the medications they take. How when you're young, maybe you take it as a liquid, that pink bubblegum flavored stuff, or it's a pill or a tablet. Sometimes we get anecdotes. Sometimes we keep moving on. Sometimes they give me vocabulary definitions for other words, like medication. A lot of times I get is something that your doctor gives you, which really fits for a prescription, which is the note that a doctor gives you that tells you what to take. Then we talk about how you would take that to the pharmacy, how sometimes they give you a piece of paper, sometimes they send it through email, sometimes a prescription is to go get physical therapy. So sometimes a prescription looks like a lot of different things. Then we talk about what an infection is. It's a growth of germs in the body, how it's both bacterial and viral, and sometimes it can be fungal. Pus. The word pussy is not a word. Something is filled with pus, just in case you ever wanted to know that, because they have said the other word that is spelled the same. So then we talk about, Have you guys ever gotten a cut and then it gets red and infected and then sometimes white stuff comes out? Well, that's pus. Then since one of the bacterial infections we talk about deals with the respiratory tract, we talk about respiratory, how it's the tissues and organs that help you breathe. In the past few lessons, we've talked a lot about what a tissue is. It's not the thing you blow your nose with, what organs are, all of those things. We talk about a rash, and a lot of times they give a lot of examples. Well, a rash is when your skin itches, or it's when you get bumps, or when things are red. So we talk about, yeah, so that's when it's irritated. Sometimes it's swollen, it might be raised up. Thermometer, it's what you use to take your temperature. Then we talk about antibiotics. And a lot of times they say they give that to you anytime you're sick. And so then we stop and we talk about it and how antibiotics, because it's a bacteria biotic, how those only work with bacteria. If you have a virus, an antibiotic is not going to help you. It's not going to make you feel any better. And then a lot of times when we get to the words like symptom, they'll say, well, a symptom is a fever. I'm like, yeah, that's true. It is. It's a visible sign of being sick. So it might be a fever, a cough, a sneeze, vomiting, etc. So I didn't put those on your slides because I wanted you guys to be able to think about it like a learner does. They don't know what the vocabulary is coming in. So we were able to do this relatively quickly, but sometimes vocabulary takes us half the lesson because they have lots of questions. These are words that maybe they've only heard orally. Maybe they're words that they haven't really heard much before. So then, like I said, we typically do a matching game. And sometimes, I don't think it's so much in this one, but there are times where they start with the same couple of words. So they'll go, a treatment. And I go, okay, but we've got two that say a treatment. And then they have to read them. And sometimes, it's just slowing down, saying, yeah, a medication is a treatment, but what kind of treatment, etc. So what are bacteria? Bacteria are living things that only have one cell. So then we would talk about how our bodies have hundreds and hundreds and thousands of cells. You can only see cells under a microscope, and then they can look like balls, rods, spirals. And they're so tiny that you could line 1,000 of them across a pencil eraser. Now I'm reading all of these, but we would have different learners read them as there's typically at least 2 other people in the class with me. So, but it can take place where sometimes they need help. So like under my, okay, so let's break it down. Like, okay, good, etc. And then and then most types of bacteria don't make you sick. They are helpful. So then we talk about how maybe your gut has bacteria and it helps break down food. So not every kind of bacteria is bad. Some of it's actually very good for you. Some of it makes yogurt or blue cheese or adult beverages. Some of them are in there to help destroy disease-causing cells or give body different vitamins by breaking down different things in your body. So this is one where we would, I don't want to say guess common bacterial infections, but I feel like for them it's a lot of guessing. They might not know what a bacterial infection is versus a viral infection. But since we had recently done viral infections, it wasn't so much of an issue. They had a little bit more of an idea of what a viral infection was versus a bacterial infection. So we talk about upper respiratory infections, streptococcus or strep throat, whooping cough, Lyme disease is a bacterial infection, cellulitis, pneumonia, and staphylococcus or a staph infection. So, excuse me, this presentation, we're not going to go through all of them. In a lesson, I did, I think, 4 out of the 7 that there were. So we were able to get through about 4 of them. So streptococcus, and then we would talk about strep throat. So we talk about how a lot of times doctors will just say strep, and it's a type of bacteria, and there are different kinds, type A and type B. And since it's a bacteria, we can use antibiotics to help treat that. Then we talk about type A and how it causes strep throat. And if you see someone who has strep throat, this might be how their throat looks. It can also cause scarlet fever, which follows strep throat. So if you have strep throat, it's important to go to the doctor because scarlet fever can be deadly. Strep throat, not usually, but if it turns into scarlet fever, it's a lot more of a problem. It can cause impetigo, which is a skin infection. Since I did not have a picture of impetigo, at this point, we stopped the slide presentation. We pulled up a picture of impetigo. We looked at some different pictures and things. It can also cause toxic shock syndrome, which again, we went and we looked at. And then I read the cellulitis and necrotizing fasciitis because I am well aware that those are very large medical words, but it is flesh-eating disease. So, which is not fun for anyone. So again, if things are not looking right in your body, call your doctor. This doesn't seem right. I can't breathe, I can't sleep, I can't swallow, whatever the things are, talk to someone. Then we talk about strep B, which is can cause blood infections, pneumonia, and meningitis. We specifically spent a whole 5 minutes talking about pneumonia because pneumonia can be bacterial, can be viral, or it can be fungal. Your lungs are very sensitive. You can get pneumonia through almost anything. So, not great. Adults can also get strep B infections, especially if they are 65 or older or have extra health problems. A lot of these individuals either live or are very close with their families. So they might, you know, oh, my mom had strep B and it was really bad and we had to do this. And, you know, she was in the hospital for a long time. So just again, making it relatable. But strep B can also cause a urinary tract infection, more blood infections, skin infections, and again, pneumonia. But strep B and strep A use different kinds of antibiotics. So if you have strep throat, and maybe you don't finish your antibiotic, and then a couple weeks later you get a urinary tract infection, you say, hey, I had health literacy with Andrea, and she said that they were the same thing. They were both strep. I bet I can take it and it'll be okay. You cannot take it and it will not be okay. They are different bacteria. They will not, one bacterial or antibiotic does not kill all bacteria. So then we would go through a few more, I want to say diseases, but a few more issues and problems, different things. And then at the end, I always like to talk about when you need to talk to somebody else. When is something a problem where you can't handle it on your own? So when should you go to the doctor? I understand this is a very big list because bacterial infections can present in so many different ways. So I highlighted a couple that are especially important. If you're having difficulty breathing, if you can't breathe or you can't get rid of a cough or you end up coughing up things that aren't clear. So if things are white or red, you need to call your doctor. You might not have to go to the emergency room. You might not have to just show up at your doctor's office, but it's important to call your doctor and see if you do need to go. You know, if things are unexplained red or swelling, or if it's getting bigger, or if you have a cut on your arm and then all of a sudden you're getting streaks around your arm, like they're glowing down your veins, that's important to go talk to your doctor. If you get a fever and you can't seem to break it, it'll go away for a couple hours and then it comes back. You need to go call your doctor. If you can't hold down liquids, if you're vomiting or you are always going to the bathroom and you just can't hold things down, you need to call your doctor. Especially if things are red or pink. Could be something is wrong with your gut. You might have blood in your urine or vomit. And those can escalate very quickly. If your stomach is extremely hurting, if there's pain and cramping and nothing seems to help, call your doctor. Excuse me. If you have a really severe headache, you can't see straight, it hurts so bad, call your doctor. Sore throat that lasts more than 2 days, or something that looks like it's infected and it isn't getting better. You put triple antibiotic and a Band-Aid on it, and the next day it's still red, it still hurts, it might still be warm. Maybe you do that again, and on that second or third day you wake up and it's still red and it's still not getting better, call your doctor. Hi doc, I cut myself, I washed it out, I put triple antibiotic on it, it's not getting better. They might say, okay, we'll see you later this afternoon, or depending on where or how bad it is, they might say, okay, we're going to send you to the emergency room. But these are things that if things are not looking better, go talk to your doctor. Antibiotics. If you get a bacterial infection, antibiotics are the typical or usual treatment. When you take an antibiotic, it's especially important to follow the directions. And then we talk about, what directions are, how often they might have to take them, what that looks like. And then we talk about why it's so important. Because if you don't finish your antibiotics, it can cause antibiotic resistant bacteria, which means that if you get sick again with the same sickness, the antibiotics aren't strong enough and the bacteria will win, and then you keep getting sick. And you can spread those infections more easily because the bacteria can't fight it. Easy ways to prevent it. Obviously, there's hand washing. And a lot of times these things are also things that I ask them to think about when I first show that first slide. So again, how would you prevent it? Well, they all look and say hand washing. Like, good, it's a great start. Also using thank you, hand sanitizer. Like that thing that we've got all around us now. Why can't I think of the word? If there are surfaces that you touch a lot, like your phone or your keyboard, make sure you're cleaning those off every once in a while. If you sneeze, make sure you're sneezing into your elbow. Ways to protect each other. And then at the end, I always ask, does anybody have any questions? Any comments, concerns? Usually at that point, we have some either anecdotes or they have more questions. And typically on this page, I also put where I get my resources. So I like Healthline, which is run by the government. It's a really nice website. And then also Medline Plus, which again, as you can see, .gov is run by the government. They're easy to read. There are lots of extra links, lots of resources if you're not understanding something. When I say, okay, learner, I know you're not that great at reading, but here's a great resource, go have fun. No, but maybe I would read it and then come back and talk to them next week and say, you had some questions, or I could tell you didn't really understand some stuff. Let's talk about it again now that I know more about what you didn't understand. But what do? I don't know anything about health. How can I teach someone something I don't know anything about? There are resources at the end of every slide. So if you end up using these slides, make sure that you look at those before you talk to your learner. Read through the slide. If you're still not understanding and you've looked at those resources, maybe put this off a week. Reach out to somebody else. Reach out to myself. Reach out, see what else you can find. Look on Google, see what that Google definition is. See if that helps you. Sometimes it does, sometimes it doesn't. If you're in the middle of a lesson and they say, I have this question and you're also not sure, pull up whatever resources you have available, whether you have those other resources already open or you're pulling up Google, but ask those questions together. Find them out together. Well, that took a lot less time than I thought it did. Did anyone have any questions for me so far? Some of the most common health questions. Since we've talked about it a lot, I no longer get, what should I do when I go to the doctor? I'm scared to call the doctor. I don't know what to do. What do I say? We've done that lesson a few times, but a lot of times it's, hi, my name is, either I see Dr. So-and-so, or I'm looking to make an appointment with Dr. So-and-so. If something is wrong, hi, my name is, I usually see Dr. So-and-so, but I cut my arm and it's really red and hurts now. I think I might need to talk to a nurse. And then just giving them confidence that it's okay to call and say, I'm not sure who to talk to, but I have a question. Can you help me? And have a piece of paper. Write down your question so you remember what you're going to say when you call them. When I first started, there were a lot of questions about the vaccine and viruses, and should I get vaccinated for the COVID-19 vaccine? Should I get vaccinated for everything? Should I vaccinate my children? Since we are not medical professionals, we cannot tell them yay or nay. What I do is I say, let's talk about it next week. Or, since I knew that was one coming up, we talked about viruses. We talked about how viruses make you sick, how they can live in your body, how they can make you sick later. Like with chickenpox, chickenpox can come back as an adult and be, I can't think of the word, shingles. Thank you. I kept thinking of not shingles. And then it's just giving them the ability to say, okay, I think I am going to get that vaccine, or no, I'm not going to get that vaccine, but to have the confidence to say, well, I talked to someone in health, and because of what she told me, no, I'm not. Not just because, well, my Ellen DeGeneres said it was bad, so I'm not going to do it. Those aren't good reasons, but at least they can say, okay, I don't like the look of the side effects. I don't like, this about it. So that's why I'm not going to get it. Or, wow, after talking to somebody, I realized that my friend Joe, we barely made it through high school together. He might not know as much about the vaccine as he says he does. Maybe I should talk to somebody else. Any other questions? Yes.
So we have some on that, but super interesting. When we are helping people who are still living or finding ways that confidence to be able to circle up with the power
Yeah.
to say that make it that once, maybe during the time you able to advocate yourself in the sense of I want to be an
Mhm. Yeah.
The hard thing is they ask for those they're already experiencing that.
Right.
Is it a struggle to kind of go from, because I know you have a lot of general information topics, and then when people want to specific, it's like, well, there's only so much that I can tell you, my level. Number two, like privacy related things, that might not feel like it can help somebody. So I guess what I'm looking for is what kind of tools do you recommend for when you're talking to somebody to empower them to versus, enabling, so to speak, like, oh, let me do that for you, but you can't, or maybe wanted to really help, because this stuff.
Yeah.
And then you talk, and I'm sorry, I'm wondering, it's really helpful, and I wonder how much support do you have from our health department, not doctors, are they willing to, like, is there someone like, hey, I can recruit this patient advocate, might be able to help do that? Are you building those connections?
Okay. That's okay. So the first part of your question was asking like how to empower and build that confidence in people who struggle to do this, who might just be told, well, the first available is with Dr. James and you just need to get in. So sorry. And, maybe they wanted to see Dr. Sue because she's a person of color, but, they don't have that confidence to say, no, I'd like to wait. So if I was working with someone who I knew was getting ready to make an appointment, I would say, fantastic, I'm so excited. Let's create a script for you, or let's write down your questions. And, sometimes it might not be a lot of words because we know that they struggle with reading, writing, comprehension, but it's enough to help them get through it. They know to now say, hello, my name is, I'm looking to make an appointment. Well, then they say, the next question might be, well, do you know of a doctor that you'd like to see? And maybe then they can say, yes, I'd like to see a female doctor. So, writing down the things that they want to have, or they say, well, our first available again is with Dr. James. Do you have a female doctor available? Having that question sometimes just ready is enough to help boost that confidence because they're already doing the hard thing. And sometimes when you're already doing it, you have this adrenaline, but then if you don't know what to say, it all falls down. But if you have the adrenaline and you have the questions, you can make it through to the end of the phone call and then, oh my God, I made an appointment for myself with at least a female doctor. And then sometimes once you get in there, you might meet this doctor and you may have thought, I really needed to see a doctor of color. And at least for the first appointment, it's okay because you saw a female doctor. And then you can say, I really liked you, but I'd really like to see a doctor of color. Or I really liked you, but it's just not working. And sometimes we don't make that conversation. I know I haven't always had that conversation. And sometimes you just don't schedule with that doctor again. But it at least gave them the confidence to make that first appointment. So then when they call again, they might say, oh, well, you saw Dr. Sue last time. And maybe now they can say, I liked her, but I want to see, do you have someone of color in your office? I'm okay to wait. It's not urgent. Or I'd really like to see a doctor of color, but it is urgent. I'm worried my arm is going to fall off. So for right now, yes, I'm okay with seeing that other doctor. So having that script, hyping them up, getting them excited, following through the next week. If you're working one-on-one, obviously that's a lot easier to be like, hey, how did your phone call go? Sometimes in a group setting, since I typically work in a group, I can't always have those conversations because I don't want to call people out in front of a group. Let me finish the second part of her question, and then I'll be with you, Jackie. Okay, I'm sorry, remind me of your second question.
It's okay. So, the second part is kind of like, okay, well, obviously, empowerable is great, pointers that you gave, wonderful. However, we run across sometimes people who, run across the kind of, just want to take over and try to help them, but really maybe there's something that's more appropriate because they're personal questions to, even if you do call them,
Okay.
so do you currently have anybody that you work with?
That's right. Okay.
Even though it's not, it's still.
Right. Okay. So yeah, so this part is how do you help either patients or themselves advocate for themselves, either creating an appointment or once they're in there, getting that advocacy that they need. I currently do not have resources. However, I do work at Ascension Borges, and I do know that in all of their primary care offices, family health, they do have, I think they're called nurse navigators now, or nurse coordinators. I'm sorry, I don't remember the exact term, but they are people that either the provider can say, I'd like you to touch base with this patient. I don't think they quite got everything you were talking about, or things like that. I'm most confident that Bronson has a very similar role. Unfortunately, I don't know much about the community health, but I do know that there are people available in the office to help these people. And I would say if somebody can't make an appointment for themselves, find out if they have a family member who can help at least make that appointment, and then get them to that first appointment. And then from there, they're able to help connect some of those dots. Yes. Okay. 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 Mm-hmm. Okay. Fantastic. Yes. Okay. 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 Right. Oh. I have not, I'm sorry, what was it, the document called again? Okay. Okay. Yeah. Okay. So I have not really talked about the medical directives. It is something that we could at least talk about, how to fill out, how, why it's important, why you might need to talk to your doctor about it. It's just one of those topics I have not touched on yet. Okay. Okay.
I guess my question is, do they, when they're asked that question, do they really know what they're being asked? I don't think the reception is going to explain that.
Right, right. And I think also part of the empowerment aspect is to have the empowerment or the knowledge and the confidence to say, I don't know what that is. The receptionist asked me if I had some medical document, end of life. I don't know what that is. I'm in my younger 30s. Is that important for me to have right now? Is that something I can do a little bit later on? Is that something you can help me with? So maybe they're asking that to their doctor, maybe they're asking that to their tutor, maybe they're talking to their family about it, but just giving them the confidence to say, I don't know what that is. Yeah, no, I understand. It is an important document. Sadly, we should all have an end of life plan, or what to do if we are disabled. But yeah, so just having that confidence to still say, I don't know what this is. My doctor said I had to go for some radiation or something. Well, no, you're going in for an x-ray, or I'm not doing that because my doctor said, blah, blah, blah. Well, we need to do this because of A, B, and C. I'm referring you for this test because you hurt your shoulder. This will tell us what's up with your shoulder. So I think my answer to your question is just giving them the confidence to say, I don't know what that is. Can somebody help me with that? Is this something I have to do right now, or can I do it when I come back next time? Exactly. Exactly. But yeah, so just starting with I don't know what that is, and then we can work on the rest of the questions as they come up. Anyone else? Thank you.